Greetings, everyone. So, today I want to talk about understanding appendicitis. A few weeks ago, a patient came in on an emergency, and with all he complained and with the signs and symptoms that we saw, and then together with the laboratory investigation, doctor diagnosed this patient of appendicitis. Diagnosed him of appendicitis, and immediately we were talking to the relation on getting ready for surgical removal of the appendix. The relation funnily denied it. She was like, no, that's in their family, that they have never had anybody undergo any form of surgery, not to talk of appendix, that they normally don't have appendix in their family. It was actually a very funny scenario because tell me how you want to deny that you do not have an appendix. Everyone is born with an appendix. In fact, appendix is a part of the large intestine. It is a small pouch that is attached to the beginning of the large intestine. Okay? Appendix is a small pouch that is attached to the beginning of this large intestine. Usually when we are kids, appendix helps to regulate our immune system. It has a kind of immune function, boosts the immune system, and it serves as a reservoir for healthy bacteria in the GIT, or in the gastrointestinal tract. So, but when it becomes inflamed, it is called appendicitis, and it becomes an emergency. It becomes a case that needs to be treated, because in as much as we are all born with appendix, we can also live without it. So if the appendix becomes inflamed, it is called appendicitis, and this inflammation can be as a result of the blockage of the appendix by stool, or by an infection, or by a swollen lymph tissue. These things now can cause the appendix to get blocked, and once it gets blocked, it becomes red and swollen, and it starts causing pain. The pain usually starts from the belly button or the navel, and then it radiates to the lower right side of the abdomen, because that is where the appendix is located. It is located at the lower right side of the abdomen, at a point where we call the McBurney's spot, or McBurney's point. So once it gets inflamed, the pain, first sign is that the navel gets to start paining the person, and then it further radiates down to the exact point where the appendix is. Other signs include loss of appetite, nausea, that is feeling like vomiting or even vomiting, feeling weak and tired, having pain while you are moving, pain while coughing, pain while moving. You understand? And the pain is very excruciating. It can even spread to other parts of the stomach, depending. So the only cure for appendicitis at that point in time is to do a surgical removal of the appendix. You need to do surgery to remove the appendix, so that the pain and the inflammation, there will be no more further spread of infection. If the appendix is not removed, it can burst in the abdomen, and if it bursts, it causes further spread of infection, and even cause a life-threatening condition known as peritonitis. Peritonitis is a life-threatening condition. It is the inflammation of the peritoneum, the membrane that protects the abdominal organs. Once there is infection in the membrane, definitely all or most of the abdominal organs will become infected, and this is a life-threatening condition. That is why once a patient is diagnosed of appendicitis, the only way to get rid of it or to get it treated is to do a surgical procedure. So every pain in the stomach is not ulcer. Every pain in the stomach is not just a normal thing. If you feel pain, it is important that you go to the hospital. If you feel constant pain in your abdomen, it is important that you go to the hospital so that we can know what is wrong with you. And always remember that everyone is born with an appendix. Alright, take care. Bye.